Okay, guys, a very good evening. This is Dr. Anisa, your social dentist, and I'm really excited for today's conversation. Okay, so I think you guys are all waiting. So today, I'm going to soon have with me Dr. Deepil Mehta, and he's going to share with us his journey as to his journey into the field of cosmetic dentistry and his journey as a smile designer and how he got to where he is right now, literally at the next level, with one of the biggest training academies in the country. So I'd like to listen about his journey and let us learn a few things about marketing, branding, and life from this inspiring journey, right? And before I actually call him, if you guys are watching this and if you can hear me, you can just say some highs. I might be able to check the comments from the phone because I'm using a software. I can't really see the comments. So I hope you guys can hear me. I'm going to soon get Dr. Deepil. So before I actually get him inside the window, how are you guys doing? How is the lockdown treating you guys? Hope you are having a nice time at home, staying safe, and not endlessly consuming the information. And I was really wondering, what if we didn't have social media right now in our lives? I can't imagine what would be our mental state if we were not in a position to be able to connect with people. And so I think it's really a boon in these times. And so now, without much ado, I'm going to welcome Dr. Deepil Mehta. Dr. Deepil Mehta has done his master's in endodontics and aesthetic dentistry from DY Patil in 2010. And he's into private practice since past 14 years now. And he is a principal dentist of a group practice which is spread over 3,000 square feet in a state-of-art training center. And he's a director of the Next Level dentistry. I don't think he needs any more introduction. And actually, there was a whole list which I asked him for a biodata, and actually I got a whole list, and it's exhaustive. So I'm not going to read that whole list. And what I'm going to do is actually call him in, and while we talk to him in a candid style, we will discover the different things that the man behind your smile has actually done on his way to stardom. Okay, so let's get Deepil in the window. So here he is. Just bear with the tech guys. Okay. Hi, Dr. Deepil.
Hi, Nisa. How are you?
I'm fine, thank you. Thanks for making the time for this.
Thank you for having me on the show.
You're welcome. So just tell a hi to our viewers before we actually start the interview.
Okay, so good evening, everybody. Dr. Anisa has been very kind and given me a very kind introduction. So the people who know me, yes, hi. And for the guys who don't know me, I'm Deepil Mehta. I'm an average dentist who works hard, like everybody.
Now you're
And
trying to be
Dr.
modest.
No, I'm trying my best. And so the plan is, like Dr. Anisa has said, is to I'm going to share whatever my journey from how I started as an endodontist, moved on, and how at this point of time I have restricted my work primarily to um, restorative dentistry. I wouldn't call it cosmetic dentistry, restorative dentistry on teeth and implants.
Okay, great. So there is a whole list actually which I had got, okay, in the biodata, and I'm not going to read that, Dipple, because it's exhaustive and it's going to bore the people. So if
A
I
lot
had
of
to
it is
just
fake as well. So
So if I have to just describe this man in one word, in one line, it would be the man behind your smile, and he's almost synonymous with the adjective smile designer. Okay, and so this journey has really intrigued me. And so, Dipil, first I would like to know, tell us something about your journey. What made you decide that root canals do not excite you and cosmetic dentistry does?
Well, I really don't have the answer to what made me decide, but it was just destiny. I started my MDS in 2007 in conservative endodontic dentistry. So the department is
Okay.
called conservative endodontic and aesthetic dentistry. But when we go
Okay.
in, we have the mindset of doing endo, 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 endo. And that is the mindset that even I went in with, because endo crown is bread and butter for
Yes.
99% of practices in our country. But I don't know, I saw some diastema cases, and I was, Facebook wasn't there so much then, we didn't have
Yes.
University of Facebook then,
Yes.
which is very inspiring. But it was just destiny, I like to do a lot of direct composites, direct
Okay.
veneers. So that
Okay.
is how I developed my love for aesthetic dentistry, and that's how it started. That's how it started. Where composites was my first love, and now I'm really bad at composites, so I've moved on to porcelain.
Oh, cool. So I was just reading the year. Okay, the year was 2010 when you finished your masters, right?
That is
Yeah.
right.
So we are in 2020, and they say it takes 10 years to be an overnight success. I really like that. So,
Absolutely.
what I want to know is that 10,000 hours of effort is required to be called an expert. That's what most of these success books say. So,
Yes.
how was the journey of doing so many veneers? Can you just talk about that?
Well, so like I said, I'll tell you how it started was I was doing a lot of endo during my PG, and I was very interested in doing aesthetic work. So what also happened was my then girlfriend, now wife, Mukta, was in the ortho department. So she would get all the patients who rejected ortho with gaps. She's like, ortho nahi chahiye, chalega. I'll show you another doctor jo 5 दिन में करके देगा. And so we had like a small mini business there, where if
Wow.
the patient didn't want ortho, she would get the patient to me, and I would offer the patient my treatment plan. That if you don't want to do ortho, you have something, um, we can do veneers as well for you. In India, in departments then, at least in 2010, there was not a lot of awareness, I would say, number one. And then moving on to awareness, there was not enough machinery, there was not enough material.
Right.
So I don't know, for some reason, I had the passion, I had the desire to do it. So I would go ahead and get my materials. I would get my impression material, my cords, give it to my laboratory, bond it. The
Okay.
charge of the patient was 0 rupees. He wouldn't be paying anything.
Right.
And I managed to do close to 100, 150 veneers in PG.
Wow.
And
Wow.
so that was then, that was in college. And we were discussing, and I'm a hardcore clinician. Everything that I do is clinical. So we actually have a hotel down where I practice. It's called Shir Sagar.
Okay.
So in Shirsagar, all the guys who have gaps have veneers for free, but
Wow.
they have veneers, and that's how you
Wow.
learn. They have implants as well. They may not have crowns on their implants, but they surely have an implant buried inside their bone, and that's how you learn. So my first 100 veneers were from my pocket, but hopefully, I'd like to believe it's given me good dividends later.
So my takeaway is two things. One was your setting with Mukta to get the cases,
Yes,
and
absolutely.
second was those veneers which you did for those restaurant guys for free, and they
Right.
worked like your free word of mouth marketing, right?
Well, that was not entirely my clientele also. I'm not looking at treating waiters,
Of course not, but still.
but that certainly, and I still follow them up. When they come and give me
Wow.
dosa to my clinic, I still see their teeth doing great, and it's great follow up. And that was
Wow.
for me to improve my expertise to work, know my failures, and maybe I
Yes.
did over 100 units then, and 10, 15 of them failed, and they have taught me far more than the remainder 85 which have stayed. So that's how it was, work, 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 understand the failure, and God
So
has been
learning
kind, I would say.
Yes, learning from failures is so important. Yeah, yeah. So really
Absolutely.
nice to know. Absolutely nice to know. And how is Dipil Mehta when he's not working? What is Dipil Mehta outside of work and clinic?
Well, you have to ask my kids and my wife that. But Dipil Mehta, if I have to describe him, is a very family loving guy. I love my family. On my list of passion and priorities, my family is 1 to 10. Everything is 11. So I like to spend time with family as much as I can. I understand the lockdown has been difficult for a lot of us business wise, but I would go ahead and say this was the best time of my life. Never did I think that I would get 60 days with my kids. With my kids, not I don't have to share them with their friends. I just have to share them with the phone, TV, but that's manageable. And I don't think I will get time like this. So I have really enjoyed this lockdown until now. So he's a family loving guy. He's reasonably hardworking. Dipil Mehta, yeah, that's about it. He likes sports. I like cars. I like sports,
Okay,
and
great, great. What sport you like?
I love football and cricket. I play a lot of football and a lot of cricket.
Okay, that's great to know. Great to know. Okay, so what was I interested in knowing is what was that turning point which really decided that you want to be called as a smile designer? What was that turning point in your life?
Called as a smile designer. So there would be two aspects to this. One would be called as a smile designer to patients, and then moving on to be called as a smile designer by fellow colleagues. So what I did, Anisa, is when I moved into my practice, we were a 450 square foot practice. We were
Okay.
actually a 300 and then moved on to a 450 square foot practice. This was 2006 when I started. So we were not a big practice then.
Okay.
It all started with my dad. So history wise, my dad was somebody who had like I mean, if I have to say whatever little I am now, there is only one person responsible for that, and that is my father. Of
Okay.
course, the Almighty and full family, but he is my biggest inspiration. He's my biggest support. And so he started from a 100 square foot office to a 200. So when I moved in, it was around 450 square feet. And then we moved on slightly bigger practices. How it started was, of course, I did all this in college, and I told dad, we should offer this treatment plan to our patients because our practice is endo crown.
Right.
So a lot of patients, you know, a lot of patients in every practice have that complaint that when you grind your tooth down for
Yes.
a crown, they're saying that to nikal gaya. I mean, you've already
Absolutely.
knocked half the tooth
Yes.
off. So
Yes.
how I started was that if you're paying X for a crown, I will charge you only an extra of my cost price, which would be 2-3 thousand bucks, whatever it was,
Okay.
and I will give you a crown that is no black ring. It looks beautiful, and I don't have to cut your tooth down. So patients accepted that, saying if he's cutting my tooth down and giving me a crown with a black ring, in very colloquial terms, for say 6,000, 3,000 extra, and we get a good crown, और वो दांत भी ज्यादा नहीं काटता. So
Correct.
this is how the word spread in my community that he's a guy जो अच्छा crown देता है, दांत ज्यादा भी नहीं काटता है, और temporary भी देता है. So I would temporize them. Temporary
Okay.
was my winning point, A lot of
USP.
people skip temporaries, yes, and a lot of people are like, एक दिन भी वो दांत के बिना जाने नहीं देगा. So that's how the word spread. And then we started getting patients who wanted small diastemas. So again, it started with composites because that's economical.
Right.
And then I started offering the patients of something which is more permanent, in which you don't have to polish your every year or something. So that's how the word spread, and I started getting patients for smile makeovers. And then there's always one or two special clients who like your work, and then they tell everybody. So you
Yes.
always have those people. So you take good photographs of those people, make a nice
Yes.
small portfolio, send it to them on WhatsApp, and the word spreads. So
Yes.
that
Yes.
was patient wise. That was patient wise.
And how did the patients accept you, because it was your father's practice? That problem a lot of people have. So how did you
Absolutely.
brand yourself in spite of being there as like a shadow? Sometimes they are under the shadow of their
Yeah,
parents. So
absolutely.
how did you
So
do that?
that was always the case. There was always a time where people would, my dad would say, "Hello, how are you?" And then he would transfer the patient to me, and the patient would look at my face and would like, "ये बच्चा क्या करेगा? ये बच्चा काम करने वाला है." So there is always that time. It takes a little time for the patient to trust you. It did take time for me as well. It did take time for my wife, but eventually, you need one good patient who is happy, and then the word spreads. Maybe yes, there was a 2 3 year period where everything I would do had to be endorsed by my dad saying acha hai, acha hai. And after that it was reasonably okay. So it wasn't
And
very
what?
difficult.
So you don't have conflicts like how those typical father-son conflicts happen. Because I know a lot of friends of mine who have, parents as dentists, and they are at loggerheads all the time.
No, surprisingly no.
Okay,
And
good.
never, as a matter of fact, I mean, everything that I have planned or I have thought, my dad has been extremely supportive, to the extent of giving me complete freedom. So my dad was a risk taker. So he took a risk in giving me freedom, and hopefully it's paid dividends. So no conflicts, nothing that I can remember at all. No conflicts as such.
Okay, great, great. And how did you actually? What was the role that social media played as far as your branding journey was concerned? As long as
So,
getting, reaching out to potential patients as well as potential course participants. What was the role of social media?
so social media for me started, like I said, when we started 2010, there was no University of Facebook. In 2013, there was only one authentic social media platform for learning, which was called as the ACE Institute. That was
Right.
formed by Dr. Nitish Suratu, who's now in New Zealand, and my mentors, Dr. Ali Tunkiwala and Dr. Udatkir. So in 2013, I'd gone to Galip Gurel in Istanbul to train. And I came back and I then met Dr. Ali at one of his courses and I showed him my work. And Dr. Ali is like, Dipil, you're doing good work, you're documenting well. Why don't you put it on the ACE Institute? And then it was a completely moderated forum. So you couldn't post.
Yes.
You had to email
Yes.
it to them.
Yes.
And
Yes.
if they thought you're worthy, they would then post it. So then they were kind enough to post a lot of my work. And then a lot of people started liking it. I got a lot of people calling me saying, you're doing good stuff. Nobody ever told me, will you teach? I was
Okay.
29 then. I was 29 then. So nobody thought, he's too young to teach, but he does good work. And then end of 2013, Dr. Ali called me and he told me, Dipil, what are you doing November, whatever day? I was like, nothing. Anyways, I don't do a lot. And he's like, will you speak for Impaat's anniversary program? And I was like, absolutely. I would be honored to speak for my mentors. And that's how the ball started rolling.
Okay.
In 2014, I was invited in the Sri Lankan Academy of Aesthetic Dentistry as one of the main speakers. And that again gave me a lot of footage and a lot of confidence for somebody who was not, I didn't even think of it. I did not think of courses. I did not think of academy. I did not think of education. It just happened. And then Dr. TV Narayan and Tarun Kumar, they encouraged me a lot. They told me, take over the course of academy, this academy, that academy. And that's how I started speaking. And then 2016, I thought, I think I should do something on my own as far as academy is concerned. And that's how Next Level started. I used to still lease the area out of Illusion, that is Andheri. And last year, by the grace of God, I thought not traveling anywhere, not doing anything. Like we were discussing, in 2016, I traveled for close to 50 to 60 days. So that's a lot of Sundays away from family. And I thought that's enough, and you have to cut it down because I don't want to not see my family so much. So coming back to your question and cutting down on my history is how you wouldn't know Dipil Mehta if there was no social media. I think that's one answer that should answer all your questions. Is if there's no
Absolutely.
social media,
Yes. It
nobody would know
answers
me.
it. It answers it. Yes.
So massive role was a massive role, is a massive role, and will stay a massive role. There is no doubt about it.
Okay. And I think Facebook amongst all the channels, I think it
Yes,
goes without saying. Yes.
there's no doubt about it. Facebook, only Facebook. I mean, I'm hardly on Instagram, but only Facebook
Correct.
has worked for me.
Correct. Okay. Interesting. What was that? Do you know any one person whose smile correction you did, which you can never forget, and why?
One person whose smile correction I did. So in a good way or a bad way?
That I leave it to you. You can never forget it.
No, it's usually one of your first cases. Usually one of your first cases. Um, well, there was again in PG where my first big case. It was a 6 unit case, and it was again referred to me from Ortho by Mukta Singh. She's a lady who wants to get married, isn't getting married because of the big gaps, and she doesn't want Ortho. The father, of that girl is like, she cannot have braces. She's seeing alliances. She's seeing boys. Please get done. Whatever needs to be done quickly. So it was a case that, of course, there was no charge. It was for free, and
Okay.
the father was very emotional once the results were there. The patient, the daughter of that father, was very emotional. And these are the times you realize, that as dentists, we have so much of power. We can change lives
Yes.
of people.
Yes.
So money
Yes.
comes, money goes. That's the circle of life. But we really do have the power. So that was my first case, and I don't know if I haven't seen her lately, but I still have a number. So maybe I'm going to call her for a follow up, maybe a 12-year follow up. I still remember her name. Her name was Sarika Boyer,
Wow.
and yeah, that's what first cases are, right?
Yes, yes, absolutely, absolutely. And what was your, in these few years, what was your biggest challenge which you had to overcome in this journey?
The biggest challenge that I've had to overcome is dividing time between clinic, education, and
Yes.
family. It's sometimes becomes extremely difficult. There have been times I've been working 6 weekends straight, 7 weekends straight, with traveling. So if you see 6 weekends, 7 weekends, that's 60 days with no break, no Sunday, and every day is 8 to 10 hours. So that takes a massive toll on your health.
Uh,
You
yes.
sometimes
Yes.
talk to yourself saying, "Ye 60 days will get over, and then thoda thanda hai, then it's okay." But it's never ending. It's never ending. So I would definitely say division of time. But now having the academy next to my practice has really helped, where I can still divide the time. I've reduced traveling almost completely in India, except Delhi and Mumbai. Nowhere else. I don't plan to do anything anywhere else except Delhi and Mumbai. So that would be the challenge.
Okay. 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 And as far as aesthetic dentistry goes, who was that mentor that really was instrumental in your success? Really instrumental.
Who was that mentor who was really instrumental in my success? Well, there have been too many. Like I said, everybody's helped me in one way of the other, one way or the other. Internationally, then I would say Galip Gurel. Nationally, Dr. Ali Tunkiwala. Now, again, I would say Dr. Ali Tunkiwala. I follow his work, and I bug him for guidance big time, and he helps me a lot. He's very kind. And there's somebody who I haven't met and I haven't learned from as far as dentistry is concerned, but there's somebody who I'm learning from every day as far as branding yourself and inspiring. If you know, his name is Dr. Michael Appa. If you've heard of Dr. Michael Appa,
Yes.
you will know. So he is a massive inspiration to me. He's a massive inspiration. Never had the opportunity to interact with him directly, but someday soon, hopefully.
Great, great to know. I think that's going to be important information for our viewers. Great. And
Yes.
did you
If
ever
you don't know
visualize?
who is,
Did you ever? Yeah.
so I was saying, if people who don't know who Michael Appa is, just Facebook him, Instagram him. He is big time, big time.
Okay. Great, great. Okay. So, did you ever visualize yourself as, as somebody who's passionate about teaching, or you were more, always visualized yourself as a clinician?
I still visualize myself as a clinician. It's out of, I am 10 hours a day, 6 hours, 6 weeks a day clinician, you know, 10 to 8, Monday to Saturday. Clinical dentistry. A lot of people, of course, everybody knows me for my veneers, but I do as many implants as veneers per year. As an endodontist, almost stopped doing a lot of root canals. Of course, I love doing them, but implants and veneers is what I'm big time concentrating on. Uh, what was the question? I forgot the question. Sorry.
The question was, what was that? You know, as far as your 100, I'm
Even
also getting
at
confused
least I
once. What
forgot the
was
question.
instrumental? Sorry, sorry, I'm so sorry. It was about yeah, it was about what was you were passionate about teaching as
Yes, yes.
teaching
Sorry,
or doing clinical dentistry. So there
I
are
am
some
still
people who are
passionate.
extremely passionate about teaching, and there are some who are very passionate about clinical. So where is the passion?
So no, if I have to choose one, it has to be clinical dentistry. There is no doubt about it.
Okay,
I
okay,
never thought of myself as a teacher. It was just happened by chance. And I'm still not a teacher, to be honest, Anisa. I don't teach as much. So even people who've come and whoever I have shared my whatever little knowledge I have with know me as a clinician. So even for our courses,
uh-huh.
uh, I would go ahead and say this with complete humility and the grace of God. Is there are very few practitioners in the country who do live cases for
Yes,
courses because it's not easy doing live cases for
yes,
30 people there
yes,
and
yes,
maybe 5,000 watching it on Facebook Live. The
yes,
intention of doing it, because everything can go wrong, starting from nothing can go wrong to everything can go wrong. But the whole intention of doing a live case is not to show you how cool I am. It's to show you how there can be issues in the middle of a
yes.
treatment and how it is our job to make sure that is corrected and we give our patient the best. So I am a clinician and I would choose clinical dentistry.
Okay.
Education also is, like I said, I'm doing whatever I'm doing is hardcore clinical. If there are a lot of people who ask me a lot of theoretical questions, and my simple answer is I have no idea. And if you, that is Google will teach you better.
Absolutely. So, if it would not be for aesthetic dentistry, what would you do?
In dentistry, implant dentistry.
And outside of dentistry, if you would not be a dentist,
I would like, I would like to be a football player. I don't know if I would be so
okay,
fit,
you can
but
expect
if
all
it
weird questions from me.
wasn't for, I don't think I'm so fit. But if it wasn't for dentistry, I would certainly be doing something business oriented, something with, I don't know what kind of business, maybe marketing. I would, but some form of business for sure.
Okay, so coming to marketing that you're pretty passionate about, what is that part of marketing which really worked for you? So, what is the role in the branding and marketing journey into what right now you are at? So, how was, what part of marketing has really worked for you?
Um, well, I would say, as a marketing, somebody who shares a lot of marketing tips like yourself, content is king.
Yes.
Okay, so when as a clinician, I'm telling people, business to business or business to client or customer, is I am a clinician. So my what worked for me was exhibiting my clinical skills through the form of, through cases, through case studies, through publications, etc. After which people started getting a little more interested in this guy called Dipil Mehta. So the first thing that worked for me is content.
Yes.
I'm not that pretty to go on and show myself on Facebook as far as non-dental stuff is concerned. So people have only, they come to me for whatever I can share only because of clinical dentistry. So what worked for me is, of course, putting my cases on social media.
Okay.
So skill is one thing, yes, and I would say as important as skill is how you document or communicate with your skill. So skill is part one of the game, but I know
Right.
people who are far more skillful than I am. But if you cannot communicate or document your skill well to your potential clientele, and that is what I think is lacking, unfortunately, in Indian dentists, to be honest, right? Us Indian dentists, all of us, is we are very skilled. We are extremely
Yes.
skilled, all of us. We are
Yes.
hardworking. That is
Yes.
inborn in us. But we cannot communicate the need of a treatment plan, for example. We're afraid of communicating that treatment plan because we ourselves are not confident of what we're putting on the plate for the patient.
Yes.
So, if you are not a good communicator, if you're not good at documentation and communication, your skill is of no use. So, I think those are the two things that I really concentrate on a lot. Uh, that is especially in practice as well, is visual communication and verbal communication. Visual communication is extremely important for me. It's like when you walk into an Oberoi or walk into a Taj, nobody over there needs to tell you that over here your meal is going to be for a few thousand rupees. You already
Yes.
know that because you've stepped into it, and that's visual communication. And then when somebody comes and tells you this, that's verbal communication. So I think both have a very important role to play, and in all forms of life, I would say, clinical dentistry, in terms of education, everything.
So soft skills and communication is very important.
Mandatory, mandatory, absolutely yes.
Okay. So fine. So I'm now going to get into some. I'm going to check the comments. Actually, give me a minute. I'm going to check the comments on my phone if there is some question which anybody has put in. Uh, Otherwise, I'm going to just visual communication. Yes. Okay. Sorry. Okay. So there are
If you
no
want to see an,
questions. I can
I was
see. I
saying, if
can
you want to
see.
see an example of branding, that's my cup.
Next
It's
level.
next level. Yes, absolutely.
Yes, that's exactly what is required, honestly, because you need to be good at your work. That's the most important thing. But you need to also let other people know how good you are, and that's where the branding comes into the picture, right?
For that,
So
you need to value your self skill. For that, we need to value the talent that we have. For that, we need to value the hard work that we've put in. If we dentists only think, "Okay, how can we charge so much money?" then you're just on the wrong note.
right. Okay, so now I don't think there are any dental questions. I'm going to go in certain questions which are going to be a little
Please,
bit different. Okay, so I always
absolutely.
have this, this thought that when they talk about balance, okay, I feel on a personal level, balance is a kind of an illusion. I feel it's always one thing at the cost of the other. And so, what is the
Yes.
price for success that you paid?
What is the price of success that I paid? A loss of family time.
Okay. And Corona has been kind in a way that you're getting it.
Mm, absolutely. Nature gives you back, gives it back to you. So yes, Corona. Thank you, Corona. I would say at least for this. Not otherwise, but yes,
I
always
can
a
see.
positive lining on everything. I'm
I
actually
can.
sitting in my son's room.
Yes, yes, I can see that the Spider-Man behind, and I can see
Yes,
the kids' closet, and I can so much
yes.
relate to that.
This is the only room because this is supposed to be their room, but they're always in our room breaking things down. So this is the most peaceful
Same
part
here.
of the house, but the door has to be locked.
So when I do my lives, I also do it from the kids' room, and that's the most peaceful room because they don't end up
Absolutely.
staying there. I totally get it. Okay, so the next question is, what is the best piece of advice that you ever received?
The best piece of advice that I ever received um, would be from my father. And like I said, my father also was a risk taker. He started from scratch. So he always advised me to work hard, So he's one of the most hardworking and disciplined people. So he always told me two things: hard work, discipline. So that is one piece of advice that I think has really helped me and should help everybody, as a matter of fact.
Great. Um, and what was sorry, I'm just getting a message. Sorry for that. What is your favorite failure that actually set you up for later success? Had it not been for that failure, probably you wouldn't have, had this success, something like that. Is there any incident like that?
Well, a lot of failures. Like I've said, I've had a lot of failures as far as work is concerned, as far as cases is concerned, in my initial times of practice, and that's how you learn. But there was this incident in my final year BDS where I was held back for, I would say, a silly mistake of mine, and that gave me a lot of strength. That gave me a lot of strength, and I, my family was very disturbed. My parents were very disturbed that मेरा बेटा ऐसे fail नहीं हो सकता. And I don't know, God gave me a lot of strength, and ultimately it was a matter of 2 to 3 months or 2 months where the results were changed. They realized it was a mistake on their part, not my part at all, of the
Okay.
MUHS, where there was something in which they thought I had revealed my identity, and it was an issue of miscommunication from their side. But that really taught me a lot of things. Of course, that was a failure, but that taught me, what am I losing at the end? I'm not losing anything more than 6 months, and 6 months is hardly anything. That 6 months can be utilized for so many things. So that uh, changed my life, I would say. That gave me a lot of strength. That gave me a lot of vision. That helped me value time a lot because I would lose 6 months. But I've always been a very positive person. I've been, I don't know, blessed with that mentality of looking at everything positively. So I thought I can utilize that positively, upgrade my clinical skills, start working on extracted teeth, because to pass finally was not a big deal. But so that was one failure that opened my eyes for sure. There's no doubt about that.
I don't know what's the correlation, but I have at least spoken to 3 or 4 people who lost 6 months, and today those people are pretty successful. I don't know if there's any correlation, but I just happened to speak to a few of them, and this is the pattern which I noticed. I don't know. Okay, so the last few questions now. What was the best gift you ever received?
Best gift, I would say the best gift I ever received, of course, is Mukta's gift to me are my kids. I mean, I don't think there can be any better gift. I know that's a very emotional statement, and I'm trying to get some brownie points here. But yes, I think that was the best gift. Materialistic gifts, yes, but emotionally, definitely the kids. Very cliched answer, but true.
Yeah, actually. Okay, describe yourself in 3 words.
In 3 words, uh, hardworking, positive, God loving.
Great, great. And if you would have any 3 friends over for dinner, who would they be? Only 3 friends. You have to name them.
Friends right
Yeah.
now. Okay. So out of family, right? Out of family,
Yes.
I have a
Yes.
very close friend whose name is Sudarshan Narayanan. He is into shipping right now. I've known him for 30 years, 30 plus years, I think. I would like to have a very dear friend of mine and a very famous dentist, Dr. Ankur Agarwal,
Okay.
a very dear friend, like an elder brother to me. Helped me a lot in making the practice that I have right now, Green Park Dental. All of us have heard about it. I took a lot of tips
Yes.
from there.
Right.
And again, from dentistry, I can't think of it. There's so many friends. I don't want to. So this is two. This is you put me in the spot. Third one, I can't think of anybody.
No problems, Dipal. No problems. Okay. Okay. Now I'm going to quickly wrap this with few questions, which are just going to. You need to just choose one. What is your favorite quote that you live by?
I have two quotes. Please give me one extra on this one.
Sure.
Number one is you are your thoughts. So whatever you think, you become. And the other quote is what I have blown up and put in my academy is hard work beats talent.
I've seen that. Yes. Yes. Absolutely.
So that's why it's there. Every day I see it. I see it every day.
Great. Great. That was a really good one. Both of them actually really resonated. So I'm going to wrap this up maybe with few rapid fire questions. One last question because I'm constantly
Please.
overwhelmed. So I want to know what do you do when you are overwhelmed?
I thank God. Overwhelmed with a lot of good things and bad things. I mean, I don't know. That's just inbuilt. I thank God for everything that He's given me.
Okay. And are you a very spiritual person?
I'm a very spiritual person. I don't believe in rituals, but yes, I believe in the superpower without any
Okay.
doubt.
Okay. Okay. And did you actually ever visualize, the next level academy, which was there, which is like a 3,000 square feet academy, and whatever
Right.
you've achieved up till now, did you ever visualize that like a in front of your eyes you have this visual exercises which people do? Did you ever do that, or it just happened?
No, everything was planned. I did visualize it, not a long time ago, but once I started speaking, once the practice started growing, I did visualize a practice which was at this level, which was this big. Uh, I did visualize. I always fancied having, an office in which you can see the sea. You see these photographs, right, from practices abroad, where from the chair you can see the ocean. So I did visualize it. Once there was an opportunity, we did plan. So yes, I would say yes, I did visualize it at least 2 to 3 years before it actually happened.
Yeah, and I really believe power of visualization and the secret, and I just wanted to affirm that, and that's the reason I asked you this question actually.
That's what I said. You are your thoughts. If you think, there is no power in the world that can make sure it won't happen, right? If you think, it has to happen. There's no doubt about that. That's
Absolutely,
why I
absolutely.
always say, that you have to think before you think. So if you think something wrong or negative, like people right now, Corona, dentistry is going to be doomed. Those are the people who are going to suffer. Completely negative mindset. I see no reason. I think Corona, for dentists who are listening, is the best opportunity for you to upgrade your practice. Do the right thing.
Yes.
Do the right thing, and there's nothing that can stop us. We're doing the right thing, doing honest dentistry, doing top level dentistry. People will always have teeth. So why not?
Yes, and people are going to get married. People are going to have job interviews. People are going
Okay,
to
so
need
yes.
teeth. So
So if I may just take 1 minute and I'll tell you what is happening now. I was in this frame of mind, Anisa, that people would not want smile design right now. Economic
right,
slowdown, etc.
yes,
So you and me, a lot of people during this lockdown have been only doing Zoom sessions,
yes,
Facebook lives, and seeing
yes,
themselves so close on camera. I have over 12 patients booked in for smile design because they don't like their teeth after they're seeing themselves in front of the camera.
absolutely.
Right. Right. So they're like, I've been doing Zoom, Zoom, Zoom. I have one side up, one side down. I need to get this done. I'm like, wonderful. You're welcome anytime.
Yes, and I totally agree with you. And it's going to be there. We are into the healthcare industry, and it can never have a recession. So I think all those doubts and all
True.
those things which people have in their mind, I think it should put that to rest, and it's definitely going to be
Absolutely.
we're going to bounce back. Yes.
Absolutely.
Okay. Okay, so Deepil, you want to tell anything else to the viewers before I actually do a quick rapid fire kind of a question wherein you have to just choose this or that before I close?
Mm. Do I want to tell everybody? Not really. I think, again, just with the negativity surrounding our industry, and negativity gets a lot of footage because it's like the news. People sub masala they put, ye hone wala hai, wo hone wala hai.
Yes.
No, I think I'm not saying that's the wrong mindset. I'm an optimist, but I'm a practical person. Of course, there is going to be a recession. Of course, it'll be difficult, but this is a great opportunity. If you've ever thought you want to upgrade, right now. So if you, there are going to be two types of dentists now. So dentistry is going to be pre-corona and post-corona. The
Yes.
dentists who don't upgrade now will, I I hope they don't get the disease, obviously. But
Yes.
if you don't upgrade now, you will not find a better opportunity or a reason.
Absolutely. I totally agree with you there. And that was a really good message for the audience. So I think it's better late than never. And it's going to be a pre COVID and post COVID kind of an era which is going to come in. And I
Absolutely.
think we need to be prepared, and we need to change. So now I'm just going to
Yes.
quickly go into the comments, Deepil, before I just start my last bit of
Please.
questions. Oh, Dr. Rajiv Verma is there. Thank you, sir, for watching. Had to break my social media lockdown rule for Dipil. Dr. Rajiv Verma says, that's great. Thank you, sir, for watching. I think a lot of the DBM guys are there. Dr. Rajiv Verma has written a lot of comments. Dipil, you are the Gushi brand, he says.
I'm the what
Okay.
brand?
Okay. And
If Rajiv Verma sir is listening, uh, my first ever veneer on extracted teeth that I did was under his guidance, and I'm always going to be grateful for that, sir. So thank you for your wishes and blessings always. That was in my internship. I did his course when I was an intern, 2005.
yes, I think Dr. Rajiv Verma has positively impacted a lot many dentists than he even knows
Absolutely.
through the social media, as well as through his extensive travel and the number of years that he has been into the profession. So thank you, sir, for watching us. We're really grateful you actually broke your social media detox to actually come on to this. Thank you, sir. And so now, before I actually wrap up, Dr. Deepal, let's just do this fun thing. Okay. So we know you a little better. Okay, now you have only seconds to answer this.
Done.
Books or TV?
TV.
Tea or coffee?
TV. Not TV. T.
Okay, quickly. This has to be fast.
T.
TV shows or movie?
Done. Money heist. Whatever that is.
Phone call or text?
Phone calls.
Gym or yoga?
Yoga.
Okay. The next was cardio or weights, but I'm not going to ask that now. New clothes or new phone?
New phone.
New phone. Okay. Dine in or delivery?
Dine in.
Pasta or pizza?
Pizza.
Family or friends?
Family.
Beaches or snow?
Beaches.
Logic or creativity?
Logic.
Okay. Clinical or training?
Clinical.
I know, I knew that actually. Morning or night person?
Night.
Night? Okay.
Can't get up so early.
Interesting. Okay. Passion or purpose?
Purpose.
Fame or money?
Money.
Thank you for being honest. Last one. Love or respect?
Respect.
Okay, great. Thank you so much. You've got full marks, Deepil.
Thank you.
So, guys, that was Dr. Deepil Mehta, the man behind your smiles, and that was the journey from Miles to Smiles. Dr. Deepil, thank you so much once again for taking the
Thank you,
time for this.
Anisa. Thank you. It was fun. I really enjoyed it. I hope all my answers were very politically correct. Nah, I'm just joking. No, no. But I enjoyed this. I enjoyed this a lot. And thank you for having me. It was fun. Thank you for spreading the word on when you say marketing, and I know Anisa speaks a lot about marketing, but at the end, marketing is branding your product, and branding your product is valuing your product. If you don't
Yes,
value your product enough,
yes,
won't
yes,
brand it enough. So
yes.
that's what I really believe that we dentists should start with, and that's why I keep saying that in every forum, every lecture, and I request every speaker, educator, person who shares, I request everybody to at least give 15 minutes from their time when they're speaking on whatever forum they are to make dentists realize what they are doing for the community. And if they themselves don't realize what they're doing for the community, please do not expect our patients and our community to realize what you're doing. And if you don't realize what you're doing for the community, you don't value it, nothing. I mean, I think the story ends there. So,
Absolutely, absolutely. So value yourself before people start
yeah,
valuing you.
absolutely.
So great, Deepil. Once again, thank you so much. It
Thank you,
was an
Anisa.
absolute pleasure. I had a
Perfect.
lot of fun doing this. Honestly, I had a lot of fun
Likewise.
doing.
Likewise. We had a good time. Thank you, Anisa, for having me.
Thank you. Thank you so much, guys, for watching us. This is Dr. Anisa and Dr. Dipil signing off. Thanks for listening,
Bye.
guys. Thanks for watching. Bye. Bye, guys.
Thank
Bye.
you.
Bye, guys.
Bye.
Bye, guys. Bye.